Alright, in this video, we're going to go over essentially how you recognize ST elevation. Alright, we're not going to go into the underlying physiology, we're not going to go into polarization, repolarization, and all that stuff. It's simply going to start off with, you need to be able to recognize ST elevation. The underlying physiology we can learn later, right? And the idea behind this is that we are going to use the 80-20 rule, as always, in a layered approach to learning. So the 80-20 rule says that 80% of the very clinically relevant presentations will fall under 20% of the knowledge. So if you know that 20% of the knowledge really well, you'll be able to take outstanding care of 80% of your patients. If for some reason it doesn't fall under that rule, or you have a clinical case of, for example, that it actually falls outside of the 80% of patients, that's a good time to review up to date, which you should always look at even prior to reviewing it for a case like this, and to sort of stop and think deeply about what's going on. And the second is a layered approach to learning. All right, so keep in mind, right, I don't understand why everyone gives these great detailed sort of lectures right off the bat instead of layering it. It makes it very difficult to understand. I mean, it doesn't work in any other facet of life. I mean, think about if you're dating, right? Nobody starts off with, hey, will you marry me, or let's get busy, right? It always starts off with, tell me a little bit about yourself. Oh, that's nice. Want to grab dinner, et cetera, et cetera, et cetera, right? And unfortunately, in this case, getting drunk before reading this videotape or watching this video may be entertaining, but is not going to help you achieve your goals. So again, briefly start off with a clinical case. 45-year-old male, get this crud out of the way, with intermittent substernal chest pain, non-radiating, not associated with any nausea or vomiting. The patient specifically denies high blood pressure, diabetes, increased cholesterol, or any significant family history. So you ask him any history of high blood pressure? No. Any history of diabetes? No. Any history of cholesterolemia? No. Any significant family history? No. So we'll come back to this at the end of this video. Alright, this is an EKG. It's a electrical tracing of the heart, and as I promised, we're not going to get into anything right off the bat. If you want to, we can talk about the whole pedantic thing later on, about whether this is the atrium and whether or not it's the ventricle. We'll go into that. Right now, the only thing I am concerned about whatsoever is that you recognize that this is the ST segment, this area from here to here. And this TP interval is the baseline. The other aspect of the baseline, which some people prefer to use, is the PR segment right over here. And the reason some people prefer to use the PR segment, right, not the PR interval, but this little PR segment over here, is that between the TP interval, you'll sometimes get like a wandering baseline, whereas this tends to be stable. But if you're looking at this thing, always look at the TP segment and always look at the PR segment. So, ST elevation, obviously, is the ST segment is elevated compared to the baseline here and here. Right? It only has to be, in most cases, one box. It can also be two boxes, right, or more, but it's got to be elevated. And then later on, we'll get into the headaches about what leads an EKG. Very specifically, they have to be elevated. But right now, all that matters is that one box is equal to millimeter, two boxes equal to 2 millimeters. If this ST segment over here is 1 to 2 millimeters greater than this segment over here, and again, always look at both, then that is by definition ST elevation. Okay, the most important point about this, when looking at this, rather than worrying about the fact that the P wave is atrial polarization, the T wave is replanet, right? So we can get into it, let's not. And the reason is, all you really need to do is recognize it, right? If you have, I don't know, a tomahawk being thrown at your head, right, you really don't care if it's coming spinning counterclockwise, spinning clockwise, whether it came from, I don't know, 20 feet, 10 feet, or who threw it, Annie Oakley or whatever. It doesn't matter. All you need to know is there's a tomahawk coming at your head, and in the same way, all you really need to care about is that that this little segment over here, this ST segment, is 1 to 2 millimeters greater than your baseline. And to further prove my point and be just maybe a little bit of a jerk, which is, as my children will tell you, is my special talent. All right, so how to determine whether there's ST elevation, right? In other words, the tomahawks come in your head, whether or not it's there or not, right, is going to be your best friend ever. You should always do this, is the lowly 3x5 card. And the reason you want to use the lowly 3x5 card is you can look at all these little boxes in here and everything else, and your eye's going to trick you, right? Whereas if you take a 3x5 card, or if you don't have a 3x5 card, they're all over the place, grab a piece of laser printer paper out of the laser printer and use that as a straight edge. So you need a straight edge, 3x5 cards are handy. And you take the 3x5 card and you put it right up against your baseline. And then you see whether or not this ST segment is above the 3x5 card. Right? You'll pick up all sorts of subtle things. Your eyes trick you if you're looking at a whole bunch of cross-hatching. If you remember nothing else outside of what ST elevation is. The main point about this is recognize it and use a 3x5 card or a folded up sheet of paper anytime you look at these things. And again, as I mentioned earlier, just to prove a point, if you are desperate, if you search the depths of your soul, and you absolutely, positively, just like in Dirty Harry, have to know what these things represent, go look it up. Next video, oh, you know what, we still need to get back to the clinical case. Oh yeah, back to this person. You take a look-see at them, right? You ask very specifically whether or not they have high blood pressure. You got high blood pressure? No. Got diabetes? No. Got cholesterol? No. Got family history? No. All you got is this person, right? The history is just such BS. You're not really particularly worried about it, right? Find out this guy runs marathons, and that, I don't know, they participate in the Ironman, and it's the first time they've had chest pain, right? Don't even get the EKG, send him home, and he comes back dead within 24 hours, right? He is Maki died dead. So what happens? Well, there's the classic things, right? Everyone asks about hypertension, diabetes, cholesterol, family history, blah, 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 blah. So what went wrong, you may ask? Go ahead and ask. Is that you didn't ask about one of the two things, which is always ask about Kawasaki's disease and lupus. They are zebras, but they're bad, dangerous zebras, so always asking about them, right? Any past medical history of any significance? No. What do they know what's significant or not, right? So you ask very specifically about hypertension, diabetes, cholesterol, and then always, it takes you 2 seconds, less than that even, any history of Kawasaki's disease or lupus, and the reason why is that both these are inflammatory diseases, and they very specifically affect the coronary arteries in addition to other things. And if you were to look at the inside of either one of these people's coronary arteries, it's going to be just ratty. I mean, like ratty, horrible, disgusting. All right. Anyone with lupus, assume they're a 65-year-old smoker with stents. Anyone with Kawasaki's disease, assume they're a 65-year-old smoker with stents. People with Kawasaki's disease will actually have to have, right, depending on their staging, stress tests throughout their life prophylactically. All right, so that's the end of this one. Over 5 minutes, try to keep it under 10. And to prove my point, if you really want to know about what the PQRS and T, go look it up. All right, so next we're going to move along to what ST elevation looks like on an EKG and why you should be concerned about it. And then we'll go into some of the coronary anatomy. So, hope you enjoyed it. Look forward to the next video.